Hello there. Hi, this is Bhante Ven Rakkhita Samanera, also known as Brother Ben. Today we're going to be looking at the subject of narcissistic personality disorder. Reference for today is going to be Len Sperry's Handbook of Diagnosis and Treatment for the DSM-IV Personality Disorder Manual. And I'll be working from the text directly. So I don't make any claims to be a licensed health professional. I'm simply deeply invested in the subject out of personal interest. And I have a diploma in Buddhist psychotherapy. So let's jump straight in. Let's have a look at Chapter 7 of the Diagnostic Manual. Chapter 7, which is on narcissistic personality disorder. The narcissistic personality disorder has been the subject of widespread interest amongst mental health professionals. Prior to DSM-III, this disorder was not included in DSMs or in the International Classification of Diseases, ICD. The narcissistic personality has been dubbed one of the new neurotic personalities of our times by Sperry, 1991. The widespread use of the term narcissistic personality by psychodynamically oriented clinicians was a major impetus for the inclusion of the disorder into DSM-III, Rawlinson says, and Smith in 1991. Prevalence estimates of this disorder in the general population are less than 1%. In clinical populations, the range is between 2 and 16%. However, the number of individuals exhibiting significant narcissistic traits, non-symptomatic traits, is very large, according to Stone, 1993. This chapter describes the characteristic features of this disorder and its related personality style. 5 different clinical formulations, psychological assessments, indicators, and a variety of treatment approaches that have intervention strategies characteristic of the narcissistic personality style and disorders. The narcissistic personality is quite common in Western culture, largely among those in certain occupations and professions, such as law, medicine, entertainment, sports, and politics. It can be thought of as spanning a continuum from healthy to the pathological, with the narcissistic personality style at the healthy end and the personality disorder at the pathological end. There's a table that compares the difference between narcissistic style and the disorder. Narcissistic personality disorder is characterized by the following: interpersonal and cognitive and affective styles. Behaviorally, narcissistic individuals are seen as conceited, boastful, and snobbish. They appear self-assured and self-centered, and they tend to dominate conversations, to seek out admiration, and to act in a pompous and exhibitionistic fashion. They are also impatient, arrogant, and hypersensitive. Interpersonally, they are exploitative and use others to indulge themselves and their desires. Their behaviors are socially facile, pleasant, and endearing. However, they are unable to respond to others with true empathy. When stressed, they can be disdainful, exploitative, and generally nasty. Not civil in their behavior. Their thinking style is one of cognitive expansiveness and exaggeration. They tend to focus on images and themes rather than on facts and issues. They take liberties with the facts, distort them, and even engage in self-deception to preserve their own illusions about themselves and their projects in which they are involved. Their cognitive style is also marked by inflexibility. In addition, they have an exaggerated sense of self-importance and establish unrealistic goals of power, wealth, and ability. They justify all of this with the sense of entitlement and exaggerated sense of their own self-importance. Their feeling or affective style is characterized by over self-confidence and nonchalance, which is present in most situations, except when the narcissistic confidence is shaken, and then they are likely to respond to criticism with rage, and their feelings towards others vacillate between over-idealization and devaluation. Finally, their inability to show empathy is reflected in their superficial relationships with minimal emotional ties or commitments. The following two case examples illustrate the differences between the narcissistic personality style and Mr. J and the narcissistic personality disorder, Mr. C. So I'm going to refer to a table. A comparison of the narcissistic personality style and the personality disorder personality. Although emotionally vulnerable to negative assessments and feelings of others, they can hurdle these with style and grace, shrewd in dealing with others. They utilize the strengths and use others to achieve their own goals. They can energetically sell themselves and their ideas and their projects. They tend to be competitors who love getting to the top and enjoy staying there. They can visualize themselves as the best or the most accomplished in their fields. They believe in themselves, their ability, and their uniqueness, but they demand special treatment of privileges. Possess a keen awareness of their thoughts and feelings and have some awareness of those of others. They expect others to treat them well at all times and react to criticism with feelings of rage, stress, or humiliation, even if not expressed. Interpersonal exploitative. So we're now onto the disorder. They take advantage of others, to which they use others to their own ends. Grandiose sense of self-importance. They believe their problems are unique and understood only by very special people. They're preoccupied with fantasies of unlimited success, power, and brilliance, beauty, or ideal love, have a sense of entitlement and unreasonable expectations, especially favorable treatment, require constant attention and admiration. They lack empathy and are unable to recognize and experience how others feel. They're preoccupied with feelings of envy. Case study: narcissistic personality disorder. Mr. C is a 41-year-old man who presented for therapy after his wife of 6 years threatened to leave him because his employer was pressuring him into resigning his position as a sales executive for condominium projects. Apparently, Mrs. C had told her husband that he loved himself 100% more than he loved her. So Mr. C encountered this by saying that he needed to buy $600 suits because his job demanded that he would look his best at all times, and that he was tall, dark, and handsome, and sexy, all any woman could want a man to be. Denied that he used scare tactics and exaggerated claims or other pressure selling techniques with customers. Sure, I'm a bit aggressive, but you don't get into the millionaires club by being a wimp. He added that his employer would go belly up without him, and he was too important to be dismissed for such petty reasons. Case study: narcissistic personality style. Mr. D is a chairman of a Democratic Party in Congress. Most of his career, Mr. J has been incredibly successful and effective. He is extroverted, witty, charming, interpersonally, and astute, a visionary, and effective in normalizing support for his party's political agenda. While he was in graduate school, however, a political science professor criticized a first draft of his master's thesis, evaluating his arguments as weak and his conclusions as only partially substantiated by the research cited. Prior to this, he had held the professor in high esteem, but he's questioned his competence after the criticism. And nevertheless, he swallowed his pride and reworked the thesis according to the professor's suggestions. After graduation, Mr. J lost his first job as a speechwriter for a state senator because the opinions and conclusions cited in his draft were not sufficiently well documented. He took these lessons to heart and got others to research his speeches when he ran for office. Mr. J recognized that this was not one of his strengths and that he could delegate while focusing on his real strengths, which were in envisioning policy and political agendas and galvanizing support for them. The DSM-IV description and criteria. According to the DSM-IV, The narcissistic personality disorder involves a pattern of grandiosity and fantasy in behavior, and a need for admiration and a lack of empathy, beginning by early adulthood and presented in a variety of contexts. It is indicated by at least 5 of the 9 criteria listed in Table 7.2. Formulations of narcissistic personality disorder, psychodynamic formulations by Freud in 1914 and 1976 described the original psychoanalytic formulation of narcissistic personality for Freud: parental overvaluation and erratic, liable caretaking, and life disrupted in the development of object love. In the DSM-IV, the criteria for narcissistic personality disorder, a perversive pattern of grandiosity and fantasy, a need for admiration, a lack of empathy, beginning by early adulthood and presenting in a variety of contexts, as indicated by 5 or more of the following. 1. Has a grandiose sense of self-importance. For example, exaggerates achievements and talents, expects to be recognized as superior without commensurate achievements. 2. Is preoccupied with fantasies of unlimited success, power and brilliance, beauty or idealized love. Believes that he or she is special and unique and can only be understood by people that are associated with very special people, high standard people or institutions. 4. Requires excessive admiration. 5. Has a sense of entitlement, i.e. unreasonable expectations with especially favorable treatment or automatic compliance with his or her expectations. 6. Is interpersonally exploitative. For example, takes advantage of others to achieve his or her own ends. 7. Lacks empathy and is unwilling to recognize or identify with the feelings and needs of others. 8. Is often envious of others or believes that others are envious of them, of him or her. 9. Shows arrogant, haughty behavior or attitudes. This comes from the Diagnostic and Statistical Manual of Mental Disorders, 4th edition. American Psychiatric Association produced that book. The child, Freud posited that as a result of this fixation or arrested development at the narcissistic phase of development, narcissists would be unable to form lasting relationships. In the past 2 decades, the formulations of the narcissistic personality by Kohut and Kernberg have become the dominant models. Kohut, 1977, believed that narcissists are developmentally arrested in a state that requires specific responses for an individual's in their environment to remain a cohesive sense of self, that is, the structures of the grandiose self and the idealized parental image are not integrated. He described the formulation of the self-object transference, of mirroring by internalizing, idealizing, that recreate the situation with the parents that was not fully successful in childhood. When such responses are not forthcoming and an empathic deficit, the narcissist is prone to fragmentation of the self, narcissistic injury, and unlike Kohut, who worked with highly functioning professionals, Kernberg, 1975 until 1984, based his conceptualization of narcissists and narcissistic pathology on his work with both inpatients and outpatients. He views the narcissistic grandiosity and exploitation as evidence of moral rage, which he believes results from the emotional deprivation caused by the full mother figure. Concurrently, some unique attribute, talent, or role provides the child with a sense of being special, which provides an emotional escape valve in a world of perceived threat or indifference. Thus, grandiosity and entitlement shelter the real self that is split off, that is outside consciousness. Parenthetically, for Kernberg, the real self is very strong, but harbors feelings of deprivation, fear, and rage. Finally, Kernberg, 1975, views the defensive structure of the narcissist as remarkably similar to that of the borderline, differentiating them too on the basis of the narcissist's integrated but pathological grandiose self. Social Formulation, according to Millen and Daggravy, 1985, the narcissistic personality disorder primarily arises from the environmental factors. Since the role of the heterogenic factors is unclear, the principal environmental factors are parental overvaluation, Nuremberg's exploitative behavior, and the only child style. Essentially, children are pampered and given special treatment by the parents, and so learn that their world revolves around them. They become egotistical in their perspectives and narcissistic in their expectations of love and emotion. Not surprisingly, they come to expect treatment from others outside the home in that way. When this special treatment is not forthcoming, the children experiment with demanding exploitative tactics and subsequently develop considerable skill in manipulating so as to receive that special consideration that they believe that they deserve. At the same time, they come to believe that most others are inferior, weak, and exploitable. Furthermore, Millen and Revel write that parental overindulgence is particularly likely with only children. Finally, the narcissist pattern itself is perpetuated through the illusion of their superiority, a lack of self-control manifest in their disdain for persons and situations that do not support their exalted beliefs, deficient social responsibility, self-reinforcement of the narcissistic pattern itself, cognitive behavioral formulations. According to Beck et al., 1990, narcissistic personality disorder stands for a combination of schemas about the self, the world, and the future. The central schema is their superior special schema, which develops as a result of direct and indirect messages from parents, siblings, and significant others, as well as experiences that mold beliefs about personal uniqueness and self-importance. The schema of being superior can be shaped by indulgence and favoritism. Similarly, the schema of being special can be shaped by experiences of rejection, limitations, exclusion, or deficits. The common denominator for such beliefs about self is that the individual perceives himself or herself as different from others in significant ways. The actual presence of some cultural belief or being valued or devalued can have direct effect. It tends to elicit social responses that reinforce this super feedback that can modify this feedback may be lacking or distorted. Being insulated from negative feedback may contribute narcissistic vulnerability to criticism and evaluation. Behavior is affected by difficulty in cooperation, in reciprocal social interventions. That self-indulgent, being demanding and aggressive behavior. Problems emerge when the self-schema is overactive and is not balanced by more integrative judgments, interpersonal formulations. For Benjamin, 1993, persons with narcissistic personality disorder were usually raised in an environment of unconditional love and admiration. This adoration is not accompanied by a genuine self-disclosure. As a result, the narcissistic personality has learned to be insensitive to others' needs and feelings. The adoring parent is likely to have been consistently differential and nurturing to the narcissist in training. As a result, the adult narcissist has arrogant expectation that others will continue to provide this emotional supplies, along with this nurturance and admiration is the ever-present threat of a fall from grace. As such, the narcissistic individual, who is simply normal and ordinary, faces unbearable disappointment with the parents. Thus, a burden of being special or perfect can be overwhelming for the narcissistic individual. Since this individual self-concept derives from internalization of unrealistic adoration and nurturance, the substitution of criticism or disappointment for love can be particularly devastating. The narcissistically disordered individual they're not well equipped to take it. They can dish it out, but they're not equipped to take it. In short, extreme vulnerability to criticism or being ignored, together with the strong wish for love, support, and admiration from others, non-contingent love from the presumptive control of others. If support is withdrawn, a lack of perfection is evident. The self-concept degrades into severe self-criticism. Totally devoid of empathy, these individuals tend to treat others with contempt and rage if that entitlement fails. Integrative formulation of the following formulation may be helpful in understanding how the narcissist personality developed and how it is maintained. As young children, they were viewed by others as being special in terms of looks, talents, and often as young children, we had exceptional speech development. They were keenly aware of interpersonal cues. Psychologically, the narcissist views of themselves and others and the world and life's purpose can be articulated in terms of the following themes. I'm special and unique, and I am entitled to extraordinary rights and privileges, whether I've earned them or not. Their worldview is a variant of the theme, life is a banquet table to be sampled at will. People owe me. Let's have a look at the table. 1. Behavioral and appearance considered: boastful, snobbish, self-assured, self-centered, pompous, impatient, arrogant. Interpersonal skills, second one. The cognitive style, 4. The feeling style, 5. The parental injunction, environmental factors: disdainful, exploitative, irresponsible, socially facile, with lacking empathy, tendency to indulge themselves, cognitive expansiveness and exaggeration, focus on images and themes, takes liberties with facts, persistent and inflexible, defends their project, identification and self-confidence, narcissistic rage, grow up and be wonderful. 6. Biological temperaments, special looks, talents, or promise. Early and exceptional language development. 7. Self-view, I'm special and unique, and I'm entitled to extraordinary rights and privileges, whether I've earned them or not. A kind of self-absorption and reinforcement of narcissistic style, admiration and privilege. Their goal is, therefore, or I'll expect and demand this specialness. The common defense mechanisms utilized by the narcissistic personality involve rationalization and projection or projective identification. Socially, predictable parental patterns and environmental factors can be rewarded for the narcissistic personality, which is characterized by parental indulgence and overvaluation. But parental injunctions likely was, grow up and be wonderful for me. Often they were only children, and in addition, they had sustained early losses in childhood. From an early age, they learned exploitative and manipulative behavior from their parents. This narcissistic parent pattern is confirmed, reinforced, and perpetuated. The illusion of specialness, disdain for others' views, and the sense of entitlement lead to an underdeveloped sense of social interest and responsibility. This, in turn, leads to an increased self-absorption and confirmation of narcissistic beliefs from Sperry and Mozak, 1993. Assessment of narcissistic personality disorder. Several sources of information are useful in establishing a diagnosis and treatment plan for a personality disorder. Observation, collateral information, and psychological testing are important adjuncts to the patient's self-report in the clinical interview. This section briefly describes some characteristics, observations that a clinician, and the nature of the report, which is likely of the initial encounter of this specific personality individual, characteristic, response patterns, and various objective MMPI and MMCII and Rorschach TAT tests are also described. Interview an individual with narcissistic personality disorder are different from interviewing other personality disorders. These individuals give clinicians gives the idea that the interviewer has only one person to endorse their self-importance. 1989. They typically present themselves as self-assured, pretentious, and unwilling to adapt to the basic cultural references customary to the patient role. They behave as if they're indifferent to the clinician's perspective. As long as the clinician plays the expected role, he or she is idealized as a marvelous clinician. However, confronting their grandiosity early in the treatment process inevitably will lead to rage and possibly to premature termination. They prefer open-ended questions that permit them to give extended descriptions of their many talents, accomplishments, and future plans. Rapport is established after a period of mirroring and soothing. Typical countertransference in the initial interviews are boredom, frustration, and anger, to the extent that the clinician can patiently wade through this period of mirroring. Their work of confronting and interpreting the narcissist's grandiosity can begin. This section describes typical feelings and patterns noted for the narcissist, the narcissistic personality, on the Minnesota Multiphasic Personality Inventory, MMPI-2, the Neuron Clinic Multi-Axial Inventory, MCMII, the Rorschach Psychodiagnostic Test, and the Thematic Apperception Test, TAT. These data have been useful in diagnosing the narcissistic personality disorder, as well as the narcissistic personality style or trait. On the MMPI-2 psychopathic deviant hypomania profile, and where an elevation on scale 4 is most likely, since they develop only superficial relationships A low score on 0 with social introversion might also be noted, and since they often fit stereotypical sexual roles, scale 5 in masculinity, femininity may be low, particularly for narcissistic men, if they also tend to be suspicious or irritable. An elevation on a scale 6, paranoia, may be noted. Maya, 1993. On the MCMRI, elevation on a scale 5, narcissistic, is expected. Scale 4, histrionic, 6A, antisocial, and 6B, sadistic, could also be elevated. Dura, in periods of stress, elevations on P, paranoid, and D, delusional, diso, not sign, may be noted. Since these individuals are averse to admitting psychiatric distress or personal weakness, elevations on scales AE, anxiety, D, dystonia, and S, schizotypal, are not likely. Shoka et al., 1992. On the Rorschach, these individuals are likely to produce records with a high number of C, pure color, and CF, color form, responses. These cell, not cell sign, don't respond to shading Y, YF, or FY, but often make texture T, TF, or FT responses. Meyer, 1993. Responses that reflect make the exotic or the expansive a characteristic of narcissism. Schaefer, 1954. On the TA, these individuals tend to avoid essential features of their cards, and thus their stories may be devoid of meaningful content. Cards that demand a response to potentially anxiety-producing fantasy, such as 13 MF, may yield a superficially avoidant story or one with blatant shock or lewd content. Billiard, 1993.